Greetings from Delhi Medical Association and eMedi News. Welcome to our show Chat with Dr. KK. We have with us Professor Dr. Arvind Kumar, who is Director, Institute of Robotic Surgery, Chairman, Department of Thoracic Surgery at Gangaram Hospital. Thanks to be in our show.
Nice to meet you, sir.
Year 2013. We're talking about what has gone. What's new in the year 2013, the year of thoracic surgery?
Reduce trauma to patients, provide best care with minimum body invasion, minimum pain, shortest hospital stay and quickest recovery to gainful employment.
That means in thoracic surgery you have mediastinal tumors, you have lung resection,
yes.
Everything is possible with minimal invasive?
Yes, I wouldn't say everything, but I would say a large number of things can be managed by keyhole method. Thoracotomy, as you would know, is something that has been synonymous with severe pain post-operatively, long hospital stay, ICU stay and maybe off work for at least 2 to 3 months.
Okay, give me
all that is changing.
Give me a couple of conditions 1, 2, 3, 4, 5 where
yes.
minimal invasive thoracic surgery is possible.
Okay, let's start from cancer.
Okay.
Lung cancer, esophageal cancer. More and more of these patients are now being managed with robotic assistance.
What about mediastinal tumors?
Mediastinal tumors up to about 6 to 7 centimeters size, like thymomas, we are managing with keyhole method. If they are big tumors or they are invasive
what about
tumors,
pulmonary resection?
Yes. As far as benign disease is concerned, every resection is possible by robotics.
Empyema and everything.
Empyema, more and more cases are being managed by keyhole method. Robotic doesn't offer any additional advantage, so we don't do that, but it can be managed with keyhole. That is thoracoscopy.
What about tubercular surgeries?
Tubercular surgery also can be managed by thoracoscopy. It's more difficult, it needs more experience, but with experience you can do it.
And now we are talking about minimally invasive in cardiac surgery. And
yeah, cardiac also it's finding more and more application. It's not my field, but as far as single vessel, completely endoscopic bypass grafting is concerned.
Even valves are being replaced.
Valve replacements, PDA ligations, all these are now being performed.
Okay, let me go away from your minimal invasive thoracic surgery. If you would not have been a doctor, what you would have become?
If not doctor, I don't know, I always wanted to be a doctor.
Always wanted to be a doctor.
Okay. Never thought of anything.
And this brutal gang rape, your message to the community?
It's something which is unimaginable. It has benumbed the whole country.
Did you go to the India Gate?
I did go. What actually shocked me more than the incident was the response
of the public.
At that site which we heard, and more importantly the people who are actually in control of things in our country. I don't think we saw the kind of response that this thing
they should have given. Do you feel that every PCR van should have a paramedic to give a first aid to victims?
That may be taking it too far. I would rather say that I would train the police personnel. You know, there is always a question of logistics and cost. Instead of putting a paramedic on every PCR van, I would spend few hours on training these people and giving them basic skills, but more important than is sensitizing them to the pain.
Empathy.
I mean, look at that news that 30 minutes were spent, these people were fighting with each other over jurisdiction, and they asked that boy to lift her and put her in the van. I mean, it just, I have
not
no
imaginable.
words. So
Dr. Arvind Kumar is very clear that lots of advancement have taken place in thoracic surgery. Now robotic, minimal invasive thoracic surgery has to stay, it has come, and in lots of diseases, including cancers of the lung, including mediastinal tumors, it's possible to do that. Let's thank him to be in our show, and that's all for today. We'll come back with one more show. Till that, goodbye. Thank you.
Thank you so much.
Thank you.
Thank you.